Gikundi kia AIDS Healthcare Foundation AHF na kiria gitongoretie hari kuheyana motungata ma murimu wa mukingo thi yothe. Muthenya wa ira nikirakunguiire miaka 15 ya kuheyana motungata macio hamwe na uigithia wa ciringi bilioni 7 hari motungata ma ugima wa mwiri guku bururi-ini wa Kenya. Mwena wa mathare Nairobi na kuria marahingurire thibitari wa mathare uria wakitwo weru na uria wirigirirwo gutungata arwaru a murimu wa mukingo makiria ma 2,000 hari guthima guthomithania na muno makiria kurigita na kunyitirira arwaru a murimu wa mukingo.
My name is Dr. Samuel Kinyanjui. I'm the country director, AIDS Healthcare Foundation Kenya. We are delighted today that we have reached a milestone of 15 years. But more importantly, we are delighted because of the number of lives that we have had an opportunity to impact positively. As healthcare workers, we've committed ourselves to ensure that we prevent unnecessary suffering and premature death. As AHF, we keep the clients as central.
Kuringana na murugamiriri munene wa gikundi giki kiria gitari gia githirikari Dagitari Samuel Kinyanjui ni ahithuritie ati andu matanyihiire milioni 1,294,339 339 ni mamukirite motungata ma murimu wa mukingo mwaka-ini wa 2022 na makiria githi na mbere na kuruguria mubango wa My Care Plan uria uri rungu rwa AHF na urongoreirie kuheyana motungata kuri arwaru na wirutiri munene wa gikundi kiu.
Out there, and the youth, the message I'd like to read particularly with the youth is that it is your time, and this fight with HIV, many battles have been won, but the war is still on. We're very close to the wire, but we need all the support we can get. The first support we need to get from is from the youth. The next support we need to get from is from the government.
Mwandiki mukaru ministriini ya ugima wa mwiri ruhongeini rwa kuheyana motungata hari kimtai yatugeire wirutiri wa AHF hari kuheyana motungata kuri muingi na makiria ni undu wa kuheyana mifira ya kondomu ya kuhuthirwa makiria ma milioni 52 undu umwe na ithimi citanyihiire milioni 3.8 gatagati ka mwaka wa 2010 nginyagia mwaka wa 2023 nitwerete ithiriire ministry ya ugima wa mwiri hari kweheria murimu wa mukingo ta king'uki kuri muingi gugikinyiria mwaka wa 2030.
I want to say that we are facing a lot of challenges, especially in the AIDS area, in the sense that there are a lot of youth now who are being infected with the HIV/AIDS, and which is really a challenge to the government now. And we are very happy that this institution, this foundation, have programs for the youth, that they will be engaging the youth so that they are able to counsel them, support them at this particular time, because they are the ones now who are most vulnerable in terms of getting infected with HIV.
Na kuona igongona riri ritafanitio tu thiku nini thutha wa kanja ya guthurima mirimu guku bururi-ini NSDCC kurekereria riboti iria yonanitie ati bururi wa Kenya uri namba 7 hari kugumirwo ni murimu wa mukingo. Riu murugamiriri munene wa NSDCC Dagitari Ruth Laibon Masha ni akinyiririe ati muthe wa mukingo wa mwaka wa 2023 ukahuthika guthomithia muingi iguru rigie murimu wa mukingo ita njira ya kung'ethanira naguo guku bururi-ini.
We are calling on communities, because this year we are saying let communities lead. It is impossible for the government or the partnership of the community to prevent some of all these practices that we are hearing, and we are asking us to educate each other, parents to educate their children, and also across the settings that we have, including the religious platform and the schools. So we want to welcome everyone. Every county will have their World AIDS Day commemoration, and we want to take this as an opportunity to educate ourselves and to remind ourselves the job is not done. Thank you very much.
Gikundi kia AHF kiandikithirio ta gikundi gitari gia githirikari guku bururi-ini mwaka-ini wa 2008 niguo kuheyana motungata mothe ma murimu wa mukingo kuria riu kionekanaga makiria ma kaunti 10. Handu-ini ha Muthingi TV, ritwa riakwa ni Shege Hawa wa Njohi.